Here we go.
So here we go. We are live here today from Reno, Nevada. I'm Dr. Martin Rutherford. I am a chiropractor and a certified functional medicine practitioner. At least that's what's pertinent to what we're going to be talking about today, which is fibromyalgia. This is Dr. Randall Gates, a board certified chiropractic neurologist, and we may delve into that a little bit farther in the future. Our topic today is going to be fibromyalgia. We're going to speak to you from personal experience. I can speak to you from very personal experience. I got pneumonia about 11 years ago. Next thing you know, I had fibromyalgia, chronic fatigue, Hashimoto's, thyroiditis, which we talked about last week, peripheral neuropathy, and
Celiac disease.
that too. But fibromyalgia is, some of those things are related, and fibromyalgia is what we're going to be talking about today. And we've treated a lot of fibro patients, and we've had the same confusions and the same questions that everybody else had when we started. Because frankly, when I contracted, it was a little bit more than 11 years ago, nobody knew anything, almost. And the people who did know were kind of on the outs. And then there was a lot of confusing data. And we're hoping to the degree that we can, and based on our experience, clear a lot of that up for you today, and in little vignettes and things in the future that we're going to do online. First things first, fibromyalgia, horrendous term, stupid term that doesn't mean anything, dumb term, wherever you want to go with this, it's a terrible term. I don't like the term. I don't like naming a term, or I don't like labeling a patient, first of all, because fibromyalgia come to have a very bad connotation, and that connotation is, oh yeah, fibromyalgia, yeah, it's in your head, right? You just need to pull up your big boy pants, and you just need to go and, you just need to like tough it out. Maybe you need to go see a psychologist. Well, there's all your blood tests are normal, everything's normal, you don't really have it. I mean, this is fibromyalgia, right? Your husband or your significant other is wondering if, maybe they should be hanging around because you're kind of having a tough time. Your doctors are saying you're okay. I went through all this. So it sounds like this comes from here or here. I went through this. So I get that. And the term fibromyalgia has a really negative connotation. The thing I like about functional medicine is we're not really looking at a diagnosis. We're looking at treating the patient or assessing the patient or diagnosing the patient based on what's wrong. Okay, you come into me, I think you probably got a lot, and Dr. Gates, we're a team with this stuff. I think you got a lot better things to do with your time and effort and your finances than to invest it in going into a doctor's office and spending time telling them you have fibromyalgia and taking time out of your day and so on and so forth. And so we understand that people who are sitting in front of us are sick. So you need to look at the person and hear their history and say, okay, what systems in the body could be causing that? Fibromyalgia doesn't give us that opportunity. Fibromyalgia means pain in the muscle fibers. Isn't that what it means?
That's what I mean.
You want to maybe even take it from there just a little bit and maybe go into fibromyalgia, what it actually means. When I do my talks, I have like an hour-long talk that I do on this that I have on DVD, and we talk about the brain, how people are going to tell you it's in your head. It's kind of in your head, but not the way they mean. Okay. And so in that DVD, we talk about the brain, we talk about the pain, we talk about how the pain is much worse in a fibromyalgia patient. We talk about left brain and right brain and why you have certain symptoms of lack of motivation and brain fog and short-term memory loss and all these things. We talk about physiology, about why you might have heart palpitations and anxiety and night sweats, and none of that is embraced in the term fibromyalgia. So we're going to use that term simply to communicate here, but that term needs to go. Something else needs to happen. But for the meantime, that's how we communicate to patients who have it. And there is a way to diagnose it, and there is a way to understand what it is. It's just not the way you've been exposed to, and it's the term that they use in the literature.
Right.
So we really need to use that term just for a matter of communicating. But let's go back to fibromyalgia.
Okay.
Fibromyalgia, it means pain in the muscle fibers. That gives us zero information and data on what's causing your problem or how to treat it. I'm going to let Dr. Gates take it from here for a few minutes, because we were talking about this right before we got on camera. and fibromyalgia and the different causes and the different categories that we have seen consistently over a period of years, and the data that we use to address these problems pretty successfully. So
let's backtrack back to when fibromyalgia was first being diagnosed. Let's go to the 1990 American College of Rheumatology's guidelines. Basically, at that point, they noticed this cohort of the pain population patients who don't have rheumatoid arthritis, who don't have lupus, who don't have things like scleroderma. These are all autoimmune diseases where the immune system kills the person's own tissues. And they knew these people were having pain, but they couldn't explain it. So they figured out this exam where basically they push all over the person's body. It's called an aldometry exam. And there are certain points you're supposed to press on the body with 5 kilograms of pressure. And if the person had pain at 11 out of the 18 points, and they didn't have rheumatoid arthritis or lupus, you could therefore diagnose them as having fibromyalgia.
And if you're truly a fibromyalgia patient, you probably have 118 points on your body that are tender.
Exactly. And so the evolution of fibromyalgia happened over about 20 years, such that in 2010, the American College of Rheumatology revised their guidelines. Basically, they're saying now that if someone has widespread pain throughout their body, you don't even have to be that tender. As long as this pain syndrome is causing you to suffer on a daily basis, and there's no other identifiable cause, then we can diagnose you with fibromyalgia. Now, that being said...
So in other words, for those people who want to know how you diagnose fibromyalgia in the medical model, there's no tools.
There's no tools.
There's no tools. There's no blood test.
No.
There's no neurological test.
But I'm going to go into that too. So, sorry, Kevin, about the microphone. So anyways, however, we now know there are a host of things that are wrong with these fibromyalgia patients. So even though we don't have a great test for it, we know that all of you suffering with fibromyalgia patients have certain commonalities.
And how do we find out what those are?
Well, a variety of ways.
Because everybody comes in interviews, wants to see a test.
Well, you know what?
We've been pretty...
If you have about $100,000 that you want to pay out of pocket, then we can do those tests. Because they entail doing functional MRI studies. I have a study here where it talks about how fibromyalgia patients don't shut off the pain circuits in their brain. So the pain that you experience coming into your brain, you just keep thinking about it basically, and your brain doesn't shut it off. There are a host of studies talking about Hashimoto's thyroiditis. There are a lot of people who are talking about how if...
The reason Dr. Gates mentions that is if
we talked about it last week.
Yeah, if we've had 1,000 fibro patients, what, every one of them has Hashimoto's?
A lot of them have
90%.
Hashimoto's, yes.
Yeah.
And then we also know, for example, these weird things such as that the thyroid won't actually produce thyroid hormone if you inject the person with a hormone coming from the brain to the thyroid called TSH. The same thing happens with your adrenal glands. So these are just little snippets, and hopefully we'll go into more of these. But the bottom line is the fibromyalgia patient and their spouse and their family needs to know that there are real biochemical, anatomical reasons to explain why they're experiencing so much pain. And you also need to own this, that the pain is not in the muscles. The pain is in your brain and spinal cord. That's where the problem is. Okay. So we can go on to the next topic.
Oh, no.
Did you want me to talk about the 4 groups?
Well, we can talk about the 4 groups. Where I would go from there would be a lot of the patients come in to us, and patients come to us for a variety of reasons. A lot come to get better. A lot come to find out if there's some information that they can get that they can fix themselves on their own. I usually open my talk by saying, you know, there's like 500 different things that could be going on with you relative to creating the abnormal pain syndrome that we are, since the early 1990s, calling fibromyalgia. Now, that's an exaggeration for me to make a point, but not much. There's probably 80 or 100 different things, okay? And that's the point. So how do you diagnose 100 or 80 different things? You do $100,000 worth of tests? Well, that would be a very limited practice, and that wouldn't benefit a whole lot of people. And the way you do it is you know and study the studies. You understand the mechanisms. You understand first that it's in the brain, the pain is in the brain and the spinal cord, and then you have to understand all of the things that affect that and cause it to break down. That's a lot of stuff. And it can't be assessed by testing. as we have been conditioned, which is why the medical model falls short on this. I'm going to say this every week. I'm not anti-medicine. Just understand, I went through this. You do it through an extremely thorough history. There are ways to understand these things and at least point in the proper direction by doing it. Our histories run a half an hour to an hour, and they're lengthy, and they're necessary. And then you do it by doing an extremely thorough exam, a complete neurological exam. People come into us for fibromyalgia and they say to me, why are we going to do a neurological exam? Well, because it's in your head. But it's not in your head like you're crazy. It's in your head like that's where your brain is perceiving this abnormal pain. And it is in your body because there's physiology in your body that is exacerbating areas of your nervous system that are creating this abnormal pain. And this is not theory. Dr. Gates had about 15 research papers here, and there's thousands.